Hi everyone, a blessed day to all. Praying that all of you are safe and doing well in your study. So, our topic is about the care of patients with problems in immune system. Okay, before we proceed with our topic, let me first share to you this disclaimer slide. Please note, no copyright infringement is intended, and I do not own or claim any images, designs, and any of the original information stated and used in this video. And this is for educational purposes only. If any content owners would like to dispute this, I will not hesitate to immediately remove the said content. If you happen to find your art or images in the video, please let me know and I will be glad to credit you. Here is my email, aubrey.dairit@cghc.edu.ph. So this presentation is the first part of our topic on the care of patients with disorders on immune system. And this presentation covers the following topics. We will start with the review of anatomy and physiology of the immune system, the types of immunity, physical examination, and diagnostic evaluation. So, let us now have a brief review of the anatomy and physiology of the immune system. You know that the immune system is localized in several parts of the human body. It is composed of an integrated collection of various cell types, each with a designated function in defending against infection and invasion by other organisms. Supporting our immune system are molecules that are responsible for the interactions, modulations, and regulation of the system. These molecules and cells participate in a specific interaction with immunogenic epitopes or your antigenic determinants. Presence on foreign materials, initiating a series of actions in a host, including the inflammatory response, the lysis of microbial agents, and the disposal of foreign toxins. The major components of the immune system includes the central and the peripheral organs, tissues, and cells, as you can see in this image or figure. So this figure shows the central and the peripheral lymphoid organs, tissues, and cells. So again, the major component of the immune system is the lymphatic system. It is composed of bone marrow, the spleen, and the thymus gland, as well as the lymph nodes and the ducts. Okay, so in addition, there are specialized blood cells, or what we call lymphocytes and leukocytes, that work within the immune system. So to continue with our anatomy and physiology of the immune system, so let us now discuss the organs and tissues that are part of our immune system. First, we have the bone marrow. So the bone marrow initially produce lymphoblast. Then this lymphoblast may stay at the bone marrow or proceed to the thymus. Those that proceed to the bone marrow becomes the B lymphocytes, while at the thymus gland later on they matures to become the T lymphocytes. Okay, so we have thymus. So the thymus are the single and paired gland located at the mediastinum, the primary central gland of the lymphatic system. So, the primary function of the thymus is the development of the T lymphocytes before migration to lymph nodes and spleen. So as you can see in this picture, the lymphocyte originate from the stem cell in the bone marrow. Then the B lymphocytes mature in the bone marrow before entering into the bloodstream, whereas the T lymphocytes mature in the thymus, where they also differentiate into cells with various functions. So these are the parts of our immune system. We have the lymph nodes. Lymph nodes are distributed throughout the body. So it serves as the centers for immune cell proliferation. So its function is to transport lymph, filtering and phagocytizing antigens, and generating lymphocytes and monocytes. So we also have spleen. Our spleen remove worn out erythrocytes from the blood and to store blood and platelets. It also filters and purifies our blood. So we also have tonsils, adenoids, and the hematopoietic system. So our tonsils are the first line of defense as part of the immune system. While the adenoids, this is a mass of soft tissue behind the nasal cavity. Same type of tissue of lymphoid tissues reacts also to foreign invaders of the body. So the basic function of the immune system is to defend our body against physical injury and infection, also to remove foreign body antigens such as viruses and bacteria to remain homeostasis. So there are two general types of immunity, the natural immunity and the acquired immunity. Natural immunity is also known as innate immunity. So natural immunity, or known as the non-specific immunity, is usually present at birth. On the other hand, the acquired immunity, or known as adaptive immunity, from the word acquired, so it develops after birth. So each type of immunity has a distinct role in defending our body against harmful invaders, but the various components are usually interdependent. So let's discuss further about our natural immunity. So your natural immunity is also known as the non-specific immunologic defense. It provides a broad spectrum of defense against and resistance to infection. So it is considered as the first line of host defense following antigen exposure because it protects the host without remembering prior contact with an infectious agent. So responses to foreign invader are very similar from one encounter to the next, regardless of the number of times the invader is encountered. So our natural or innate immunity co-coordinates the initial response to pathogens through the production of cytokines and other effector molecules, which either activate cells for control of the pathogen by elimination or promote the development of the acquired immune response. So the cells involved in this response are monocytes, macrophages, dendritic cells, natural killer cells, basophils, eosinophils, and granulocytes. So the early events in this process are critical in determining the nature of the adaptive immune response. So the natural immune mechanisms can be actually divided into two stages. We have the immediate or generally occurring within minutes and delayed occurring within several days after the exposure. So under your natural immunity, we have the white blood cell action, inflammatory response, physical barriers, chemical barriers, and immune regulation. So for the white blood cell, The cellular response is the key to the effective initiation of the immune response. So WBCs or leukocytes participate in both the natural and acquired immune responses. So for the inflammatory response, it is the major function of the natural immune system that is elicited in response to tissue injury or invading organisms. And the physical and chemical barriers. For the physical, we have there will be, for the physical and chemical barriers, there will be activation of the natural immunity response by process inherent in physical and chemical barriers. For the physical surface barriers, this includes our skin, our mucous membranes, and cilia of the respiratory tract, which prevent the pathogens from gaining access to our body. So for example, the cilia of the respiratory tract, for example, the cilia from your nose, along with the coughing and the sneezing responses, it filter and clear the pathogens from the upper respiratory tract before they can invade the body further. While the chemical barriers, we have the mucus, acidic gastric secretions, enzymes in our tears and saliva, and the substance in our sebaceous and sweat secretions. These act in a non-specific way to destroy the invading bacteria and fungi. So viruses are countered by other means such as interferon. For the immune regulation, it involves balance and counterbalance. So dysfunction of the natural immune system can occur when the immune components are inactivated or when they remain active long after their effects are beneficial. So another type of our immune system, or this is also known as a specific immunologic response, we have the acquired immunity. So this usually develops as a result of prior exposure to an antigen or through immunization, like vaccination or by contracting a disease, both of which generate a protective immune response. So the term immunity refers to normal adaptive response designed to protect the body against potentially harmful agents like your bacteria, viruses, and fungi. So this is just a diagram of the types of specific immunologic response. So we have inborn or acquired immunity, and this acquired immunity can be both natural or artificial. When we say natural, there are also two types. We have the active and the passive. When we say active, you get this immunity through contact with the disease. Okay, for example, measles, di ba? Nagkakaroon ka rin ng immunity kapag nagkaroon ka na ng ganong a disease. And then passive, you can get from placenta or through your mother's milk. For the artificial, we also have active and passive. So for the active, you have the vaccine or killed attenuated toxoid, for example. And then the passive, you can have your immunity through immune serum. So when our body is invaded or attacked by bacteria, viruses, or other pathogens, it has three means of defense. So we have the phagocytic immune response, the humoral or antibody immune response, and the cellular immune response. So let us discuss each of these responses in the next slides. The phagocytic immune response is the first line of defense that primarily involves the WBC, your granulocytes and your macrophages. which have the ability to ingest foreign particles and destroy the invading agents. So it removes the body's own dying of dead cells. So our body's second protective response is known as the humoral immune response, which is sometimes called the antibody response. It begins with the B lymphocytes, which can transform themselves into plasma cells that manufacture antibodies such as IgG, IgA, IgM, IgD, and IgE. And these antibodies are highly specific proteins that are transported in the bloodstream and attempt to disable the invaders. So the IgG is considered as 75% of total immunoglobulin. So it appears in serum and tissues, particularly in the interstitial fluid. So it assumes a major role in bloodborne and tissue infections. It activates the complement system and it enhances phagocytosis. It can also cross the placenta. So IgA is 15% of total immunoglobulin. So it appears in body fluids such as our blood, saliva, tears, and breast milk, as well as pulmonary, gastrointestinal, prostatic, and vaginal secretions. It protects against respiratory, gastrointestinal, and genitourinary infections. It prevents absorption of antigens from food, and it passes to neonate in breast milk for protection. While your IgM is 10% of total immunoglobulin, so it appears mostly in intravascular serum. It appears as the first immunoglobulin produced in response to bacterial and viral infections. It activates the complement system. IgD is just 0.2% of the total immunoglobulin. It appears in small amounts in serum, possibly influences B lymphocyte differentiation, but role is unclear. For IgE, it's just 0.004% of total immunoglobulin. It appears in serum. It takes part in allergic and some hypersensitivity reactions. It can also combat parasitic infections. So again, our humoral response are involved in recognition, particularly the antigen recognition. So there are several theories that explain the mechanisms by which the B lymphocytes recognize the invading antigen and respond by producing antibodies. It is known that B lymphocytes recognize and respond to invading antigens in more than one way. So the B lymphocytes respond to some antigens by directly triggering antibody formation. However, in response to other antigen, they need the assistance of the T cells to trigger antibody formation. And with the help of macrophages, the T lymphocytes are believed to recognize the antigen of a foreign invader. The T lymphocytes pick up the antigenic message or a blueprint of the antigen and return to the nearest lymph node with that message. Then the B lymphocytes stored in the lymph nodes are subdivided into thousands of clones, which are stimulated to enlarge, divide, proliferate, and differentiate into plasma cells capable of again producing specific antibodies, as mentioned in the previous slides. The third mechanisms of defense is the cell-mediated or the cellular immune response. Also involves the T lymphocytes, which can turn into specific or special cytotoxic or killer cells and other cells that can attack the pathogens. So, the structural part of the invading or attacking organism that is responsible for stimulating antibody production is called an antigen or an immunogen. For example, an antigen can be a small patch of proteins on the outer surface of the microorganisms. However, you have to remember that not all antigens are naturally immunogenic. Some must be coupled to other molecules to stimulate the immune response. So, the helper T cells, when activated, it secretes cytokines which activates and attracts B cells, cytotoxic T cells, or natural killer cells, macrophages, and other cells of immune system. Your cytotoxic T cells directly alters the cell membrane of the antigen that cause cell lysis. Our suppressor T cells, it has the ability to suppress B cell production and keeping the immune response at a level that is compatible with health. So the memory cells is responsible to recognize the antigens from previous exposure and mounting an immune response. The cellular reactions are initiated with or without the assistance of macrophages by the binding of an antigen to an antigen receptor located on the surface of a T cells. The T cells then carry the antigenic message or blueprint to the lymph nodes where the production of other T cells is stimulated. Some T cells remain in the lymph nodes and retain a memory for the antigen. Other T cells migrate from the lymph nodes into the general circulatory system and ultimately to the tissues, where they remain until they either come in contact with other respective antigens or they die. So the T cells includes the following types of T lymphocytes. So we have the effector T cells, suppressor T cells, and memory T cells. So under your effector T cells, so we have helper T cells or CD4 plus, and then the cytotoxic T cells or the CD8. So the helper T cells are activated on recognition of antigens and stimulate the rest of the immune system. While the cytotoxic T cells, or known as the killer T cells, it attack the antigen directly by altering the cell membrane, causing again cell lysis or disintegration, and releasing cytolytic enzymes or cytokines. Actually, cytokines are proteins produced by the cells of the immune system that determine the action of the immune system cells. The suppressor T cells have the ability to decrease B cells production, therefore keeping the immune response at a level that is compatible with our health. For example, sufficient to fight infection adequately without attacking the body's healthy issues. The memory cells are responsible for recognizing again antigen from previous exposure and mounting an immune response. There are 4 well-defined stages in an immune response. These are the recognition, proliferation response, and effector. The recognition response of an antigen as foreign or non-self by the immune system is the initiating event in any immune response. So, it's circulating lymphocytes and macrophages recognize the foreign materials or antigens as non-self. During proliferation, there is already sensitized lymphocytes proliferate, differentiate, and mature into respective T and B cells. And then during response stage, so in this stage, The differentiated lymphocytes function in either a humoral or cellular capacity. So during this stage, antibody is produced with T or with specific T cell action. And during the effector stage, the antigen destroyed by antibody, which is produced by B cells or cytotoxic T cells action. The null lymphocytes and the natural killer cells are other lymphocytes that assist in combating organisms. These cells are distinct from B cells and T cells, and it lacks the usual characteristics of those cells. So again, the null lymphocytes are subpopulation of lymphocytes that destroy antigens already coated with antibody. So antibody-dependent cell-mediated cytotoxicity. The natural killer cells is a class of lymphocytes that recognize infected and stressed cells, and it responds by killing these cells and by secreting macrophage activating cytokine. Moving on to the assessment of the immune system. So your assessment of the immune system includes the following: the health history and the physical examination. So an assessment of the immune function usually begins during the health history and the physical examination. So the following are the areas to be assessed during your physical assessment. So for nutritional status, the nurse must assess the patient nutritional status, including the caloric intake, the BMI, the TER requirement, and the quality of foods ingested. There is evidence that nutrition plays a role in the development of cancer, and that diet and lifestyle can alter the risk of cancer development as well as other chronic diseases such as diabetes, hypertension, and etc. The nurse must assume a proactive role in ensuring the best possible nutritional intake for all the patients as a vital step in preventing disease and poor outcomes. You also have to ask your patient about a history of infections, and you can also ask about childhood and adult immunizations, including vaccinations that provide protection against, for example, influenza, pneumococcal disease, COVID vaccines, pertussis, herpes simplex, and etc. You can also ask if for infections, you can check if the patient has exposure to contagious disease such as tuberculosis or the TB, and if the patient had underwent any checkup or, for example, had tuberculin test or what we call PPD or your protein or purified protein derivative test or any other procedures such as chest x-ray. So you can also check if the patient has allergies, including the types of allergens, for example, pollens, dust, plants, cosmetics, foods, medications, vaccines, and etc. You can also check if the patient has any disorders and disease, such as autoimmune disorders, cancer and chronic illnesses, previous surgeries, medications used, present and previous medication, as well as blood transfusion. In assessing for immune dysfunction, you must be alert for the following signs and symptoms, particularly for the respiratory system. You have to assess if there is any changes in the respiratory rate. Is there cough, dry or productive? Is there abnormal lung sounds like wheezing, crackles, bronchi? Is there any presence of rhinitis, hyperventilation, and bronchospasm? For cardiovascular system, you have to check for hypotension, tachycardia, dysrhythmia, vasculitis, and anemia. For gastrointestinal system, you have to check for hepatosplenomegaly or inflammation or enlargement of the liver and spleen, colitis, vomiting, and diarrhea. For genitourinary system, you can check for frequency and burning on urination, hematuria, and any discharge. For musculoskeletal system, you can check for joint mobility, edema, and pain. For the assessment of skin, you have to check for rashes, lesions, dermatitis, hematomas or purpura, edema or urticaria, inflammation, and discharge. For neurosensory system, you check for cognitive dysfunction, hearing loss, visual changes, headaches and migraines, ataxia, and tetany. The diagnostic evaluation for immune system disorders includes blood test and skin test, as well as bone marrow biopsy, which may be performed to evaluate the patient's immune competence. There could be a specific laboratory and diagnostic tests that are discussed in greater detail along with individual disease process in our next discussion. So as a nurse, you must be aware that the patients undergoing evaluation for possible immune system disorders may experience not only physical pain and discomfort with certain type of diagnostic procedures, but also may have psychological reactions. It is therefore the nurse's role to counsel, educate, and support patients throughout the diagnostic procedure. So, many patients may be extremely anxious about the results of diagnostic tests and possible implications of those results for their future health, employment, and personal relationship. This is an ideal time for the nurse to provide counseling and education. And, of course, to create your nursing care plan. So that's the end of the first part on our topic about the care of patients with disorders on the immune system. So for the next presentation, we will be talking about specific immune disorders and management. So that's all for now. Thank you everyone for listening and watching this video. God bless everyone. See you.